it's not an activated COVID virus. It's not, a dead part of the COVID. There's no COVID virus that's injected in either of the vaccines. How well do any of them work? They all work 100% at decreasing hospitalizations and deaths. So we have not had someone who has been vaccinated who has then been in the hospital and died from COVID-19 out of all of the millions of vaccines that have been made. Once you're vaccinated, you can feel safe that you are 100% protected from hospitalizations and death related to COVID-19. That doesn't mean that you won't necessarily get it and get sick. That efficacy is different. But as far as what our end goal was, which was stopping hospitalizations and death, all of the vaccines, Johnson & Johnson, Pfizer, Moderna, they're all 100% effective at that. Pfizer and Moderna are about 95% effective at preventing symptomatic COVID-19. So 95% of the time, you will not even know that you've been infected, not even know that you've been exposed, and you will not develop any symptoms whatsoever. That's with Pfizer and Moderna. With Johnson & Johnson, it's about 66% effective at preventing moderate to severe COVID-19 symptoms. So again, not hospitalized, but you will feel sick. It prevents that about 66% of the time, and 85% of the time, it prevents you feeling very ill. So being bedridden, feeling fatigued, the major symptoms of COVID, that is effective 85% for Johnson & Johnson, that you will not have that happen. So similar efficacies across the board, but 100% effective at what we really want, which is prevention of deaths and hospitalizations. So, like Killen said, sometimes you don't feel great after you get vaccinated, and there's a variety of reactions that people can have. These are not, allergic reactions. They're side effects that we expect, because when your body makes antibodies, it makes your body kind of think that you're getting sick, and that's why the antibodies are there. So some of the side effects or some of the reactions people have: fatigue, headache, muscle pain, chills, joint pain, mouth fever. Some people have a lot of pain and tenderness at the injection site. For the most part, these symptoms go away in a day or two. And they're usually more pronounced after the second shot. Because Johnson & Johnson is only one shot, you can experience these symptoms with that shot as well. That one's first shot. So what about the variants? Will it still work? So based on what we know, Pfizer and Moderna work as intended, as we expect it to work in the variant from the UK. But they do seem to be a little less effective on the variants from Brazil and South Africa. We don't have good data on Johnson & Johnson and whether or not it works as well for all the variants, but it's kind of behaving similarly to Pfizer and Moderna in recent studies, in which it works better on the UK variant than it would work on Brazil and South Africa. So what does working mean in the sense that it still offers some protection, but it doesn't work as well? It's a little bit tricky to explain, but there's a threshold of the amount of virus particles that cause symptoms or cause you to be sick when you have a COVID-19. So we can arbitrarily say that that threshold was about 1,000 particles. And when you take the Pfizer or Moderna vaccine, it will decrease the amount of particles that are in your bloodstream to 100. So you're not going to get sick because the threshold is 1,000. So that's for the old regular, what we call wild type COVID-19 virus. With the variants, Pfizer and Moderna, and for some instance, Johnson & Johnson, will decrease the particles, but only to like 350. So while they're not as effective as decreasing it all the way down to 100, even at 350, it's below that threshold of 1,000 that's going to make you sick. So that's why we say that it's not as effective, but it's still protective, because the threshold for sickness isn't met, if that makes sense. So I'm almost done. Frequently asked questions. Should I be vaccinated if I had COVID? The answer is yes. You should still get the COVID-19 vaccine, even if you've already been vaccinated, but you have to be recovered. So you can have active infection and get vaccinated. We want you to wait on average at least 3 months. That's when natural immunity wanes before you go and get the COVID-19 vaccine. So if you have active disease, if you're still coughing, if you're still sick, we want you to wait. But after you've recovered, yes, you should definitely go back and get the vaccine, because immunity doesn't last forever. We know that the COVID-19 vaccination lasts at least for 6 months so far, according to trials, and it probably lasts a lot longer. but natural immunity will wane, around that 3-month mark. And we've had multiple people who have come in with reinfections of COVID-19. So people who got it back March of last year are now getting it again in October. So people can come back and get it over and over again. So you want to make sure that you are protected with the vaccine, even if you have had COVID. Can you get it if you're pregnant or planning to conceive? So yes, you absolutely can. The clinical trials for this did not include pregnant women. However, healthcare workers were the first to be vaccinated, and that means a lot of nurses. And a lot of nurses are of childbearing age. A lot of nurses were pregnant when they got it. There have been hundreds of thousands of people who have been vaccinated while pregnant, vaccinated and given birth. And along with being safe, when the babies come, they do carry some antibodies as well. So it's a protection for them also getting vaccinated during pregnancy. It's not a concern if you plan to conceive or if you are currently pregnant. Can you get vaccinated if you're breastfeeding? Absolutely. And there are also antibodies that get passed on to baby as well. You do not have to pump and dump. You do not have to delay or stop breastfeeding when you get the vaccine. There are benefits to you and to the baby if you are getting vaccinated while breastfeeding. That's pretty much it. So I will stop sharing and open up to questions.
Okay, well, thank you, Dr. Curls. I just want to give an overview because that was amazing. mRNA is with Pfizer and Moderna. Johnson & Johnson is your viral vector vaccine. The threshold for COVID might not be met with these other variants. However, you are below the 1,000 that she talked about. I want to kick it off, if you don't mind. Is once you've had COVID, can you recover 100%? And I'd like for you to use an example of maybe a patient that you've had, because we are hearing these horror stories for the people that do survive, where they're having lung issues, they can't walk, just different things are going on. So
yes, so there's different types of recovery. We do find that there's something called long haulers or long COVID, and that's a syndrome that people have even after kind of recovering from the fevers and the cough, that they have long-term effects, which has now been over a year of effects on their heart, on their lungs. We have athletes who got it who are unable to return to athletics. And those are long haulers. So there's a period of recovery where the majority of people recover and go back to baseline. But if you're part of those people who are in the long hauler group or the long COVID, those people are still experiencing symptoms a year out. So for the vast majority of people, yes, they do recover, but there are a subset that do not return back to 100%.